Good morning, dear all distinguished guests. My name is Thongkorn Miyam. I am an Executive Director of Southeast Asia One Health University Network, or SEAOHUN. Um, so it's my honor to be here. I would like to thank you, the organizers, for the invitation and giving the opportunity to sharing our experience in Southeast Asia. Um, so today, I would like to first congratulate with POHA, Pakistan One Health Alliance, for having this first kickoff meeting of the One Health Workforce Development Project meeting. So I believe this is a very significant event of the network, and it's a very good step and good start for the network. So let me start by introduce our network a little bit. So SEAOHUN is a regional network of university in Southeast Asia, generating social and intellectual excellence on One Health. So let's say we aim to promoting One Health approach by using the university platform across Southeast Asia region. Until now, we have in total 115 university members with 236 faculties. We are working as a regional network, so it's kind of a network of a network. So we are working with the country network across the region. So we start SEAOHUN established in 2011 with 4 founding member countries, which is Thailand, Malaysia, Vietnam, and Indonesia. That we will have a strong network than others. Later on, we will have a young emerge network in other countries such as Laos, Philippines, Cambodia, and Myanmar. So it just recently, short before COVID. So some of the country might not be fully equipped or are not fully well management or strong in the coordinating office. But however, we implement or promoting One Health under the same vision, mission, and have the same goal. Um, in principle, SEAOHUN advocate the role of university because you will see that it's a little bit different from others networks. So this is a network of universities that we see that university can play a role. Our main role is actually our main expertise is to build capacities of professional across sectors of complex health, One Health issues. So we have more on the on building the capacities for both current and future workforce. We have some small portion of conducting the research, using research as as actually, I think we're using research as part of the capacity building. So encouraging a young researcher to help using the multi-sector, multi-discipline, a holistic approach to solving their research question that probably really helpful. We also see this role of the university as the building capacity and research expertise to help supporting policymaker by providing more scientific evidence base to help decision making at the policy levels also. So this is our goal. We are starting, we are trying to reach the goal, but we can say that still a really difficult trying to link those demands. After COVID or during COVID, you might notice that universities, as the pool of expert or laboratory capacities, student capacities, like human resource capacities, can be helping arms of the public health system during the emergency health crisis. In either way, diagnostic, testing, risk communication, or investigation and response. So that is the role that SEAOHUN would like to see at the university to be. So our mission, like to develop a resilient, competent One Health workforce by using education, research, training, excellence provided by member universities and help strengthening the country capacities. This is the snapshot from two projects that we have currently right now. So, but I would like to focus on the statistic a little bit that so it's not the just the network of the universities. Under the university, so we have a youth power as the student club. So we also encourage that the university have the One Health Student Club and having more interact and learning and sharing amongst um, different countries and also within the countries. So this is one of the platform that I can provide and give you some example. Otherwise, so we have a certain numbers of training topics, training material, scholarship, internship, fellowship, was kind of like that. I'm going to talk later on the next slide. However, we aim also to support the JE technical areas apart from the capacity building is more on the cross-cutting topics. However, we also realizing that the priority of the technical area should also support the JE score of the national. If you see in our strategy, we focus in 4 areas, which is the first one is to advocate social and policy advocacy, knowledge management, capacity building, and strengthening the organizational structure or strengthening the network and collaborations. For the first one, advocate for social and policy. If you see that why that the network is really important and really powerful, because we are from the number, we are over 100 university member across the region, then I believe we cover almost all important, not important, let's say like we cover almost all the key universities that play a role in the regions. That's why SEAOHUN, so as the regional network, so we play a role as the voice of academia in many regional and global platforms. So you will see this kind of example that so if one university might not stronger as if we are gathering together as a network and playing a role on those parts. Another strategy is the knowledge management and sharing. We start one of the project by identifying the workforce, which I guess that probably related to your event right now. So if you see this picture on the right hand side is the toolkits that you can actually this is public available. This one was developed by the global team, but not SEAOHUN. We are just part of it, but we adopt these toolkits, which is aimed to be a framework and toolkits for a competency-based program designing. But we just took some part of it and some competency to evaluate the human resource or the One Health workforce in the regions, like in every country, to see the gaps and needs. And I think this is the role of SEAOHUN to provide those data. Many partner, we know that many organizations is probably doing the same capacity building, and we are not limited the capacity role just to our network or university. So we provided this kind of information that if any institute would like to develop the training or to design the program, either curriculum or the training for One Health workforce, this kind of data would be the good database provided for their consideration and for their design in the futures. So this is a kind of very useful tools. We found that actually, if you go through the details of these competencies, One Health Workforce competencies, so you will find in total 19 competency, which is a lot. But it can divide it into a soft skill, like collaborating or coordinating skill, and the technical skill. Then I think it can be tailor-made for each organization or even each country also. Apart from those competencies assessment, we also have a learning platform that we call SEAOHUN, or Southeast Asia One Health Workforce Academy. We adopt the idea also from the global team that we would like to provide it a free learning platform for everybody. But you might know, like many organizations also provided a free online course available right now. COY is different. Why we're trying to provide it a local course, and we're trying to provide it in a local language and have a context for each country. So we are now in the developing phase. We're actually having all the content writing up finished already. So now we are trying the process of putting in the online to be available online and be able to access very soon. For the COA, and you might because we are having this idea because if I think there's some language barrier in the regions also, especially for subnational or for the a kind of a subnational or the frontline health workforce, that the local language might be easier, more accessible, easier to understand, and probably be useful in the wider audience. We do not have many variety courses because we have to cover all 8 countries, and not 7 to 8 countries, and but I think it's on the way, and try to build a little bit up on this what we have been done. So another example of the capacity building um, activities. So as academia, so we might know that each people will have different styles of learning. One of the most effective one is the experiential learning. So that's why SEAOHUN also provided the mentorship opportunity. For example, we use the terminology of the internship program for the student, or we call a pre-service, and the fellowship program for the in-service health professional. So this is to help building experience, expand more vision, or have more hands-on training for One Health workforce, either in service or pre-service. This is also another example of the sustainable professional development, because we concern or prioritize the importance of the student. So providing scholarship encourage the young generation to have awareness of One Health and integrate it in their learning program, supporting the study that related to One Health issue. So will be a one encouragement or engagement with the professional area in the futures. So not just the scholarship that we provided the opportunity, we also supporting the in-service, like either our faculty members in the network and also the government sectors that having a research or training award or training that really need support to using a One Health approach to integrate in their research question or to be integrated in their training. This is the last strategy for SEAOHUN. We also are giving the importance of value our network and collaborations. Either so this is the just the activity amongst within our network that coming together and having a chance to provide it a strategic planning together. And we also see the importance of the network and collaborations of the young generation, like in the youth, at the student One Health Student Club, that we would like to, we encourage the student club between two universities to play a role in having getting together and having a planning and facilitate the webinars together. So this way they are not only just learning the technical topic, but they also be able to learn from the collaborative and coordinating skills, even cross-cultural. Um, There is also some engagement activity. This example is to student engagement, but we also engage with the community, and it can be together with like student and community engagement program for help raising awareness and also building relationship and building the capacities across a country, and also like having a training and competitions as the one of the engagement with the young generation. I think this is all from the SEAOHUN, and I would like to encourage that we really value of our partners, either at the national, international, non-governmental, governmental organization across the region, and we are really happy to see and having a partner with Pakistan, and see if we having any other collaborations in the futures. So I really thank you so much to the organizers, and really happy if you have any question or comment or suggestion for our discussion. Thank you so much.